Good morning, Peter Goertz. I'm a psychiatrist. For quite a few years, I worked on inpatient psychiatric wards in a public hospital, and many of the patients there, many of the psychiatric patients had pretty serious physical issues, and for a while I actually worked also on a combination medical and psychiatric ward. So, bottom line, again, many psychiatric inpatients and psychiatric patients in general, but this video is just about inpatients, but it pertains to outpatients also. So many psychiatric inpatients have physical illnesses, and especially in public hospitals, you get a lot of homeless people who really aren't able to take care of themselves. So you want to make sure enough of a medical workup is done. You want to have blood work, you want to have a urinalysis, an EKG, maybe a chest x-ray, and you want to remind yourself that physical illnesses sometimes could even be the primary cause of psychiatric symptoms, like in hypothyroidism. I actually had a patient like that. Her thyroid stimulating hormone, the TSH, was I think in the 60s, which is very high, and she was quite depressed. So she needed treatment for hypothyroidism. So as a psychiatrist, you're a doctor, a physician, and it's a good idea to take a good medical history, examine patients physically also. Now, if you haven't done this for many years and don't feel like you're able to do that well anymore, that's understandable. But if you're pretty close to your training, or if you've maintained those skills, it's a good idea to do it yourself. So it's a good idea to take a medical history, physically examine patients, and just physically examine. When you physically examine patients, just that fact can give patients a good message that you're not only looking at the mental part, but you're treating them as a whole person, treating them comprehensively, looking at the mental and physical and emotional and spiritual, hopefully, parts of what they're dealing with. And touching patients actually in and of itself can be quite helpful, and not always. I mean, if someone's very paranoid, that can be a difficult issue. But in general, in that public hospital where I used to work, like I said, we had a lot of homeless patients. I remember a lady, for instance, with major sores on her legs, and maggots were even crawling in them. So if you touch someone like that, for example, that gives them the message that you do not see them as untouchable, quote, untouchable. Because many of these patients may feel that way because they're ostracized, they're marginalized in society, they're homeless. They may feel like no one wants to have anything to do with them, no one wants to touch them. So if you physically examine a patient like that and touch them during the physical exam, that can make them feel more accepted and help the doctor-patient relationship. And these patients, again, a lot of them behave quite bizarrely. They have poor hygiene, so many people may not want to touch them. So that can help to establish the relationship if you touch them. Now, major issues can be missed. And I remember one patient in a psychiatric emergency room, and he had had a physical exam, he'd had a medical history taken, and he was a young man, and no significant abnormality had been noted in the physical exam and medical history. And then I got a call from the nurse who had checked the lab work on the patient, and the nurse said his CPK, one of the muscle enzymes, was quite elevated, very elevated. And I was wondering what was going on, so I talked to the patient again and got a little more history. He said he had been shot and that the bullet was still lodged in his thigh. And that, of course, was helpful to know because that explained he'd been shot a few days previously and the bullet was still in his thigh. And that was helpful to know because that explains the high muscle enzyme value. Now, I'm saying that it's a good idea to get a medical history, etc., but a lot of these patients, including that young man, can have a lot of difficulty focusing. They can be psychotic. They may not be able to give much history. So what I'm saying is it's worth trying but it's not always possible. And in this gentleman, it was possible, but maybe previously when he was asked, he had not answered the question because he had been psychiatrically not able to, or distracted by voices, I'm not sure. So you want to review lab work, you want to review the EKG, you want to do that yourself. If someone has a physical complaint, chest pain, abdominal pain, palpitations, ear pain, whatever it is, if you feel comfortable, it's a good idea to do it yourself, to examine the patient yourself, whatever you need to do, auscultate, palpate, use an otoscope. And of course, then feel free to call a medical consult or ENT or whoever needs to see the patient. Of course, that's a good idea. You're not going to know everything medically. But you do want to try and maintain your medical knowledge as well as possible. And you want to help out if you feel comfortable doing it. Let's say a patient needs an IV. If you feel comfortable, put in the IV. Let's say you have an IV drug user who has very poor veins or is very hard to draw blood from because of IV drug use over many years, because he has no arm veins to draw blood from anymore. So if you feel comfortable drawing blood from the femoral vein in the groin, feel free to do that. So bottom line, it's a good idea to address medical issues in psychiatric patients if you feel comfortable. Thank you.